Next, it is my great pleasure to introduce our next speaker, who I believe is with us, Dr. Ramesh Zacharias, who is the president and CEO and medical director of the Chronic Pain Center of Excellence for Canadian Veterans.
Thank you very much, Jason, for your introduction. I want to thank Dr. James McKillop and Alan Fine for putting on this conference and for the leadership that the three of you and the Institute, CMCR, have provided in this area of cannabis. As Jason had mentioned, I'm Ramesh Zacharias. I'm the CEO as well as the medical director at the Chronic Pain Center of Excellence. By way of context, I should tell you that I've been involved in treating pain patients since 2004, and I've been prescribing cannabis and various cannabis products starting in 2008. I owe a great deal of my education to Dr. Mark Ware, who was a pioneer at a time when people thought it was not mainstream. So I don't know if Mark has joined this or not, but kudos to Mark, because he's been singular in his commitment to educate people on the appropriate use of cannabis. So as I said, I've been prescribing it going back to 2008 and owe a lot of that initial knowledge to Dr. Ware. So in December of 2018, Dr. Jason Bassa, myself, and Dr. Vikas Parihar, who will be joining us tomorrow afternoon when I do the talk on the use of cannabis, were hired by Veterans Affairs Canada to look at the impact of cannabis on well-being. The whole 7 domains of well-being, VAC has been singularly focused on trying to figure out ways that would help veterans, whether it's in health, in finance, in social areas, or healthcare. And so they give us a contract to look at the impact of cannabis on the well-being of veterans. You've heard earlier that cannabis has been, VAC has been paying for cannabis going back to 2007. And at the time when we were involved in looking at their database, it was close to 90 million expenditures on cannabis on veterans. It's now probably closer to 115 million. The challenge we found and the challenge that VAC has experienced is their database is an administrative database. It does not collect information around what the product is being used for clinically. So while they have a lot of information on how much they're spending cannabis on, the challenge is it has not been linked to any clinical database. So while I say that, I should give credit to Veterans Affairs Canada for their commitment to research. They funded 3 research institutes. The first one was SIMVER at Queen's, where Dr. David Pedlar is the scientific director. The second, you met Dr. Fardas Hussain, who's the CEO of the PTSD Center. And then in July 2019, we were awarded the Chronic Pain Center of Excellence, and our partners are McMaster University and Hamilton Health Sciences. And how we have determined our research priorities is we've done both qualitative and quantitative assessments with interviews now into probably a few hundred veterans of what was important to them. And cannabis was one where they said they wanted to get more information on. And so we are now funding a project that's led by Dr. Vikas Parihar, who you will be meeting tomorrow when we do our presentation, and Dr. Greg Tippin. It's a research project that we call VECTOR, which is Veteran Cannabis Therapy Outcome Registry. And even in the last 1 year of meeting with veterans, there's been information that we have got that has been extremely important for us in shaping our phase 2 of this research project. I assess a veteran every single week and probably assess close to 60 new, and by now have assessed probably over 300 veterans. The vast majority of them are taking cannabis. The benefit for it is not consistent. It's partly influenced by their diagnosis, but more importantly, on how they're actually receiving cannabis. And so tomorrow we will talk about case-based lessons learned as to how we could do it. What's important for us is that we collaborate with the Atlas Institute as well as SIMVR in a variety of areas, not the least of which is in the cannabis research. Veterans Affairs Canada did a life after service study in 2016, where they surveyed veterans to understand some of their conditions, and roughly 60% of veterans have some form of chronic pain. And when you look at the 60% who have chronic pain, 63% of them have mental health issues. So I always say the mental health issues as well as chronic pain are two sides of the same coin. I'm very excited by what CMCR is doing. I'm also thrilled to have sat in on what CIHR is doing, what NIDA is doing, what the Canadian Mental Health Group is doing. I think we're all rowing in the same direction. And I would say the next 5 years, we will learn a lot more about how to prescribe cannabis, how to monitor patients, and in what conditions will it work. So I wanted to just give you a brief overview of the Chronic Pain Center of Excellence. We're deeply grateful to VAC for the funding they have given us, and that we continue. In the last 2 years, we have funded 32 projects, and we are just launching now our new round of RFPs, where on average we will be funding between 10 and 15 research projects a year, as well as awarding scholarships. So I'm happy to take any questions that you have with respect to the CPCOE. And as I said, if you can join us tomorrow afternoon, we will go over some cases of the impact of cannabis and frankly, some of the changes we collectively need to make on how it's being delivered today. So James, Jason, and Alan, thank you very much for inviting me. I'm happy to take any questions that you might have.
Thank you, Dr. Zacharias. Are there any questions? All right. So if there are questions, feel free to add them into the chat or the Q&A. Also, if there are any questions for Dr. Mary Bartram's presentation just before, you can email the cmcr@mcmaster.ca email address, and I can forward them on to her.
Thank you so much for joining us, Ramesh. That was an excellent presentation, and I'm always reminded how innovative it is that you're not just treating pain, but you're focusing also on the brain when it comes to comprehensive pain management. So great to have you with us. Thank you again for doing double duty at our meeting, both today and tomorrow. We appreciate it.
Thank you very much for inviting me.
Such a pleasure.